Hi, and welcome to our weekly podcast. My name is Brent Dodge, and I have with me Samantha Schoeneman, physical therapist at Alpine Physical Therapy. In a moment, I'll further introduce Sam as far as her work with Pilates-Based Rehabilitation. I do need to point out that at Alpine Physical Therapy, we've had a tremendous result with the use of Pilates method in our rehabilitation. There have been great articles that have come out supporting the use of Pilates, particularly with low back pain, but I'm finding that we can use Pilates for a variety of injuries and even for various sports to enhance performance. Sam, give us a little bit of an idea of the training that you've gone through as a certified Pilates instructor.
Well, I went to Southern California and spent about 2 years going through a very established program down there. Unfortunately, the education for Pilates isn't standardized, so someone could go and do some hour on the internet and say they're certified. So you really want to make sure that whoever you're working with that's certified has gone through an established program. And for example, my program was over 500 hours of experience and training with someone that has gone through another program and that's certified to teach teachers. I had to write a paper. I went to a course every other weekend for probably about 6 months. I took 3 different practical exams, and then we had to take written exams. And it was a very intense program, and I learned a great deal, and I was certified on all of the equipment, which we'll later discuss, and also that using the mat exercises as well. And it was a phenomenal program, and I just keep learning more and more, and especially how I can apply it to our physical therapy practice here at Alpine.
Well, Sam, it's interesting to me that you bring not only the physical therapy background, but also the certification piece with Pilates. And I think that is a genuine blend that's made a tremendous impact. As you've started the Pilates program at Alpine, we've just seen tremendous results and popularity with the program. Our physicians are pleased with the work we're doing, and patients definitely see the difference. What was it that brought you around to want to pursue Pilates?
Well, about 7 or 8 years ago, I injured my back, and I was a PT at the time, and I was doing all the right things, and I had coworkers working on me, and just couldn't get better. I was getting better, but not as the best I could be, and it was frustrating. You know, as late 20s, in my 30s, I can't sit in the car for more than an hour. I couldn't go skiing, and those are activities that I felt like I should have been able to do. So actually, after some frustration of kind of going through typical physical therapy exercises and techniques, I sought out a Pilates-based exercise program and followed through with that for about 8 to 10 weeks. And the results were just in my body, my function, and with incorporating Pilates into my own life, I've been really able to manage my low back pain, and it's made my life just tremendously better and more enjoyable, and actually has really helped me apply that knowledge and empathy towards my patient population as well.
Well, I can definitely sense the passion that you have for Pilates and the fact that you've had great results in your own life. Sam, take a few moments and introduce our viewers to some of the concepts and some of the methods that you use with Pilates.
Okay. Well, first of all, Pilates is a different type of exercise altogether. It's really based on the health of the spine and making the movement as efficient as possible. It's incorporating the entire body and really reprogramming that movement so that you have balance in your body. It starts with the breath, and we really incorporate the breath with the activation of the core muscles. Most importantly, the deep abdominal muscles, often named the transverse abdominis or the TA. It's a belt muscle that attaches to your low back and supports the entire abdomen and the low spine and the pelvis. And that's the key muscle that needs to be firing. Pilates really helps to incorporate the breath and that muscle so that when you breathe, that muscle is naturally engaging. That muscle should be involuntary. It should come on without you thinking about it and support you whether you're sitting, whether you're playing basketball, whatever you're doing, it should be on and supporting the spine to protect you and put you in the optimal position. Another important part of Pilates is really working the core and keeping the base of the spine or the core stable while the arms and the legs move. I tell my patients it's similar to if you want to think about a crane, and the base of the crane has to be very stable for the boom of the crane to be able to lift something without collapsing or without having damage to the base of the crane. So if our base of the crane in our body is strong, then our booms or our arms and our legs can move much more efficiently. The other things about Pilates that I really like is that it puts the spine in a really safe position, a very comfortable position. Gravity's minimized, so you don't have to generally work on the balance and coordination. You're laying, typically we'll have someone start on a reformer, which we'll look at later. They're laying on their backs in a tabletop-like position, and that's where we start to work. The back is very supported in that position. You can really concentrate on the breath and incorporating the right recruitment patterns of the muscle to really stabilize the base of the core of the body. And then as the person progresses and as that control and the coordination of the deep abdominal muscles and the proximal hip muscles and the scapular stabilizers or the shoulder stabilizers all start working together and working efficiently, and we get out of compensation patterns that we often develop when we're in pain, then that person can get into higher level things. Now they're not only lying down, but they're sitting and they're working their arms as they're sitting. Really feeling where they should be, stabilizing in a seated position. And then we could even go to a kneeling position, and that makes the challenge even more harder or more challenging. And then we can even go and take a lot of this, what we do, and apply it to a standing position. So it's very functional in that you're basically going out there, and in the Pilates studio, it's very similar to, say, basketball, where you're going and practicing a layup over and over without any players around, and you're getting that technique right. And then once you're in a game situation, you don't have to think about that. And that's what I really look at as the Pilates session, is you're really mindfully using the right muscles at the right time to protect the spine, and you then later can walk away with that and apply that in real life, and that helps.
It sounds like it's a real graded progression, that there's a lot of hands-on involvement by the, in this case, therapist that's doing it.
Absolutely, and at all times there's cues and just minor techniques that we can do to really help you sink into the deepest muscles and really get away from the compensation muscles or the muscle imbalances. Our bodies are like pulley systems, you know. If we're too tight on one side and maybe too weak on the other, you're pulling on that joint wrong, and that's going to cause joint pain or cause postural deviation. And so Pilates really helps balance out the body and create a balance on that pulley system.
Well, thanks for the insight, Sam, and in just a minute, we're going to have the tip of the day.
Here's today's tip of the day. We are going to talk about how to actually recruit the TA, or the transverse abdominis, that really important belt muscle that helps support the spine, the pelvis, and the rib cage. It creates the core of our body's workings. Lindsay, I'm going to have you go ahead and feel just inside your pelvis bones here, about 2 inches. And you can use both hands to make sure you can feel the TA turn on. And how we turn on the TA is, it's a sensation of pulling up and in or away from your waistline. But we're going to tie it with the breath as we talked earlier, so that that TA, that belt muscle, comes on every time you breathe, and you have support in your back every time you're breathing throughout the day. So we're going to help your breath by inhaling to prepare, and as we exhale, I want you to exhale as though you're fogging up a mirror. With that exhale, you're going to draw the navel to the spine, pulling away from your waistband, pushing the low back gently into imprint or into a little bit of a flex position of the low spine, and you'll feel your tailbone pulling up. So it's inhale to prepare, and exhale, fog up that mirror, pulling up and in, peeling the tailbone up and off the mat. Inhale to pause, and exhale, release the tailbone back down to start position or neutral spine.
Sam, I'd like to thank you for taking the time and presenting this excellent information on Pilates rehabilitation. Is there anything you'd like to add in closing?
I just want to encourage folks out there, if they have tried all the other therapies, give Pilates rehabilitation a chance. And I think that oftentimes I see people that have seen several different practitioners, and it's not until they've tried the Pilates that they have that breakthrough, because they're actually reprogramming and relearning how to use their body and their muscles correctly. So give it a try.
Fantastic. For more information on Pilates, be sure to visit our website at www.alpineptmissoula.com, and feel free to call our office at 251-2323.